Over 100 executives of Pfizer's elite worldwide business technology group ranked Douglas Goldstein as one of the highest-rated speakers of their meeting. Provocative and entertaining, energizing, dynamic speaker.
You know what our challenge is, if we remember the past and imagine the future, is not just to do it. I mean, Nike was wrong. They said, just do it. Nike was wrong. And it's not just about doing it better. It's about executing best in the current environment. Who's going to execute on these visions? Who's going to execute smarter? Who in this room is a distinctive innovator? You all, come on, everybody stand up. All the distinctive innovators, stand up and give yourselves a hand for making a difference in the lives of patients. How many people want to keep reinventing the wheel? Come on, who wants to keep? Nobody wants to keep reinventing the wheel. So how do you not reinvent the wheel? You share. And the issue is, it's nice to know what they did, but what do you really want to know? How? And maybe even a 5-minute video clip or a 3-minute video clip of her talking about it. Oh, we don't have to see Kelly, but maybe just hearing her audio. Wouldn't it be nice to hear her talk about 3 minutes or 5 minutes? It doesn't take an hour. You don't have to schedule it. And how about if that's up on a website? So all these innovations were on a website, a little audio clip, and I call it, this is a technical term, get your pencils out. Stuff. I want Kelly's stuff. I want her policies, her procedures, her education material, because you know what? I want to be able to do the same thing, but perhaps quicker. I want to do it in 3 hours because I modified her 20 hours worth of work. That's collaboration. That's sharing.
Who can you trust to deliver knowledge and insights about leadership, innovation, collaboration, and technology to support transformation from all forms of internet to DNA science and beyond? For more than 20 years, Douglas Goldstein's real-world experience and thought-provoking insights have led to organizational innovation. He inspires audiences to go beyond theory to action. Douglas Goldstein, Beyond Theory to Action. Unleashing creativity and collaboration with electronic technology, digital, internet, e-business, e-health, emerging technology, DNA genomics, nano and beyond. Emerging technology for performance, productivity, profit. Energizing human performance. As a CEO and entrepreneur, Doug has built successful product, services, and technology companies for consumers and business. As a global consultant, Doug advises the world's leading healthcare organizations and pharmaceutical companies on distinctive innovation and knowledge solutions. As an e-futurist and author, Doug's books have been dubbed informative, analytical, and entertaining, a powerful roadmap, beyond theory, invaluable, a vital resource for e-commerce and e-care, and an essential guide to the future. As a professional speaker, Doug entertains, educates, empowers, and energizes thousands of executives, professional and consumers, stimulating strategic solutions aimed at lower costs, improved quality, and performance excellence.
What's interesting about Kaiser's initiative is that they understand with escalating healthcare costs and declining reimbursements that they need an imperative bigger than their Y2K effort to go online to cut their costs. And from the first 100,000 members, we have some impressive results. We have an 11% savings in visits to the doctor's office. We have a 14% of the consumers saying, I was able to treat it at home. Now understand, the web channel that Kaiser has up for their members allows them to select a doctor and get an appointment at the same time. Not through email, but through real-time access to the appointment system.
Beyond the ordinary to knowledge solutions for performance excellence. His 10th and latest book, Medical Informatics 2020, Achieving Quality and Electronic Health Records Through Collaboration, Open Solutions, and Innovation, breaks new ground in the effort to reduce errors and improve quality. His Consumer MD work is on the cutting edge of consumer-directed healthcare today. Doug's upcoming publications put him ahead of the pack with visionary predictions and practical tactics on creating the future. His widely acclaimed e-healthcare, Harness the Power of Internet E-commerce and E-care, has won over critics across the globe. Sought after for his provocative perspectives, Douglas Goldstein is a frequent guest on television and radio programs. He has served as the Internet columnist for Managed Care Interface, and his groundbreaking articles are featured in major business and healthcare trade publications. E-futurist Douglas Goldstein generates hundreds of innovative and practical ideas to grow your organization with an energizing, empowering, educational, and entertaining program.
Patients today assume that they're getting the most current information at the point of care. They think that the systems are there, and 100,000 to 200,000 deaths a year. You know what that equals? About 500 plane crashes. What a patient really wants is at the point of need. It's not just when I'm acute or when I actually have a lump big enough to be a tumor. I want earlier diagnosis. I want earlier treatment. I want you to take that blood sample sooner and really identify the early stages of tumor growth. So what we want with patient-centered advocacy is really about patients want health anywhere. What's the one or two things out of the 10 problems that you think could be causing the inversion that have to be fixed? What's the one or two that will get you 80% of the improvement that you want? You don't have to fix 15 things necessarily. And that's what a methodology like Six Sigma will do for your organizations, applied appropriately in a service organization.
Beyond websites to e-services and your customers. Gain invaluable yet practical strategies on how the latest business, technological, and healthcare trends will impact you and your customers today and tomorrow.
A product, a service that hits a responsive chord and stimulates true use. Look, websites. It's not about websites. It's about service. Y'all buy stocks online because why? It's cheaper, better, faster. Anything we can web enable in healthcare, we have to say, what is what's being proposed cheaper, better, faster, and is there a willingness of the target market to use it?
Doug stimulates and guides his clients to create real solutions for real customers using collaboration, internet, multimedia, and emerging and electronic technologies. As president of Medical Alliances, he is the creator of Knowledge Solutions, a dynamic approach to liberating the potential of people and realizing organization transformation for performance excellence. Doug has been strategist and developer of cutting-edge, award-winning projects, including Ascension Health Exchange, BShe-Share and Quality First, e-strategy and health information technology sharing for veterans' health, Medformation.com, Health Adventure, and Dream Dog Multimedia.
Anybody wonder why there's a whole new push for health IT? A lot of it goes back to the State of the Union address 2 years ago. President Bush said, by computerizing health records, we can avoid dangerous medical mistakes, reduce costs, and improve care. I would propose that an electronic medical record for every American with a personal health record facing version is a disruptive innovation. Imagine if every patient, particularly the ones today who have chronic conditions, could walk into their doctor's office not armed with books and x-rays, but armed with the data on their cell phone or a portable hard drive. The technology and the capability exists. The market segments of patients exist for that. The security methods exist. I believe Americans taking ownership of their own health records changes the paradigm. It moves it from what a provider-centric system to where the consumer is at the center. If I control my medical information, I think the consumer is going to make better decisions. I think they're going to go out and interact with their doctors in a collaborative fashion. And I think that that's going to make a huge difference with the entire delivery system of medicine. Now, we have a lot of challenges and barriers that we talked about in terms of getting there, but healthcare deserves to be consumer-centric.
Looking forward, Douglas Goldstein stimulates innovation and shares trends, predictions, and tactics to unleash human potential through collaboration, innovation, and emerging technologies to achieve dynamic change to go beyond theory to distinctive innovation.
Your distinctive innovation and your leadership is really going to make the difference in supporting people, our loved ones, our friends, our families, our customers, our patients, to be healthier. And it's really your ingenuity, powered by the tools and technologies that all make up distinctive innovation. So I thank you for your participation. I thank you for the stories you've shared. And I look forward to next year, your experts from the membership being up here and talking about how they did it, and then we can just click on the website and see their tools and their resources so that you can go forth and stop reinventing the wheel. Thank you.
Goldstein's greatest strength as a leader lies in his ability to provide tangible ideas and solutions to today's problems and implement them in short order. President and CEO, Medical Group Management Association. E-health is one of the fastest growing sectors of the internet and also one of the most complex. Douglas Goldstein bravely outlines his forecasts for the emerging e-health industry with impressive insight and analysis. E-health Medical Director, Humana Incorporated. Douglas brings that rare combination of an intimate understanding of healthcare, real-world experience, and a vision of how IT leadership in e-healthcare can transform the patient experiences. Secretary General, King Fahd Hospital and Research Center, Saudi Arabia. You are the